Welcome to a couple of Rad Techs podcast where we bring you an inside look at the world of radiology from the unique perspective of a married couple of radiologic technologists. Together, we have over 30 years of experience in the field and are here to demystify the science of medical imaging. Radiology is the unsung hero of the medical field, providing doctors with crucial images and information that help diagnose and treat illnesses. Join us as we explore the latest techniques, technologies, and innovations in radiology and discover the vital role we play in the healthcare industry. So come along for the ride as we share our passion for radiology as a married couple. On this episode of A Couple of Rad Techs, we are talking about a really hot topic, MRI technologist shortage. Yes, you have heard it if you are in the radiology and healthcare community that there is a shortage of MRI technologists. Healthcare professionals are in a crisis right now as far as being able to support hospitals and medical imaging staffing. There's an all-time shortage all over here healthcare. But we're going to talk mainly about MRI technologists, magnetic resonance imaging technologists. Who are they? What do they do? Why is there a shortage? How can we fix the shortage? What are your thoughts? I want to know what you are thinking. So before we go forward, make sure you hit the subscribe button. If you aren't subscribed already, we talk about all things radiology on this podcast. And I'd love to thank my sponsors. Magic Mind is the sponsor for this amazing episode. So let's get right into it. An introduction into magnetic resonance. Medical imaging technology has advanced tremendously over the past few decades, allowing doctors to see inside of the body in incredible detail. One of the most powerful but complex imaging modalities is magnetic resonance imaging, or MRI, better known name. MRI uses strong magnetic fields and radio waves to essentially look inside of body structures, tissues, and they help to diagnose conditions like cancer, heart disease, injuries, and so much more. Behind every MRI scanner is a specially trained technologist, not a button pusher. MRI techs are extensively trained in physics, anatomy, patient care, and actual radiology or radiology or diagnostic x-ray many times. What's most important is that they safely operate these million-dollar scanners and calibrate the machinery, position patients, communicate to put patients at ease, because many of you out there are claustrophobic. You may know it, you may not know it, but it's our job not only to operate the scanners and get these great quality images for doctors, but also to make sure you're at ease during your exam, which allows us to be able to get quality imaging for your diagnosis. And we use specialized software in order to capture these images and data. Each machine and maker has their own software, and the technologist has to be trained to use that particular software. So if they're scanning on a Siemens scanner, and depending on the software of that scanner, so you could have the manufacturer have a Siemens Esprit, but it could have different software. And if the technologist is not up to date on the software, which changes over time, in the 21 years I've been scanning, MRI scanners are totally different when it comes to software. And that's what's most important, is that we are specifically trained to get quality imaging. And it's more than pushing buttons. But we're going to talk of how that plays into the MRI shortage that is happening today and talk about some solutions. If this is a career that you're interested in, you want to definitely listen. If you are a technologist that is in radiology or medical imaging already and thinking of making advancements to your certification, listen up. One other thing that many don't know is that even experienced technologists require constant learning in order to keep pace with the complex and evolving MRI technology and techniques. They are ever changing. From the 21 years when I started, things have really advanced, from implants to certain implants that they were a no-no when it came to scanning, that now we can scan them, or there are conditions that can have to be met in order for us to be able to scan them. Who knew we'd be scanning patients with pacemakers for MRI? I sure would not have. And now they also have AI technology and also remote MRI scanning. These are so many things that are going to kind of help with the solution. Given the vital role MRI technologists play in healthcare, there is a very concerning trend happening nationwide, a growing shortage of qualified MRI technologists. While under discussed, data shows this shortage is reaching a crisis level. Some reports
warned we may see demand for MRI technologists outpace supply by over 20% in coming years. This shortage threatens to substantially slow crucial testing. I've heard other technologists say that they actually have a waiting list of months prior to patients being able to get their exams. I worked at a place where there was a 3-month waiting list at one time when the shortage was happening as well back then. So we see it happening again. And this is the prediction. But more importantly, departments operating under capacity delays life-saving diagnosis and treatment for countless patients. And that is why we're having this discussion. One study even projects delays resulting from understaffed MRI departments could contribute to over 2,200 additional cancer deaths per year in the US alone. It's an urgent healthcare issue that isn't getting enough attention. So we've seen that the shortage of MRI technologists is already having substantial impacts across hospitals and medical centers. MRI departments are struggling to run at full capacity to meet imaging scan demands. They're chronically understaffed with vacant MRI tech positions and staying open for months. This forces remaining MRI techs to take on excessive workloads, leading to burnout. I did a recent short form video on burnout in radiology, and the response was amazing how many felt exactly that way. We have to really understand, why is this shortage happening? Let me know in the comments, why do you think that MRI in particular is experiencing this shortage? Departments have no choice but to delay or reschedule MRI scans. While hospitals try to prioritize the most urgent cases, even those patients face longer waits. And for less acute issues like chronic conditions, patients endure delays of weeks and even months just to be scanned. This slows down initial diagnosis. The ripple effects of these delays can be severe. It means cancer patients anxiously wait to know if the disease is metastasized. Trauma patients with unknown internal injuries or bleeding endure additional risk. Neurology patients with conditions like multiple sclerosis or seizures see progression of their diseases while in limbo. Across every field of medicine, lack of imaging insights hampers patient care. This is how vital medical imaging is to the healthcare community. Many people do not understand how important medical imaging and radiation therapy are to healthcare. Disease advancement lowers treatment effect. And think about this, injuries not promptly imaged end up requiring more invasive interventions later on. Physicians emphasize that when it comes to diagnosing illnesses, timeliness is next to godliness. Delays degrade patient health. Another impact is MRI departments pulling in staff from other imaging areas. Often they take X-ray techs or CT technologists to help with basic MRI scanning. However, few have the specialized MRI training and expertise needed to handle more complex exams. This creates bottlenecks where only simple scans get completed. It also short staffs and overworks techs in other imaging areas. Furthermore, relying on borrowed staff unfamiliar with the MRI introduces safety risk. That's a whole nother topic, but we're going to talk about MRI safety and MRI accidents later. This one, the shortage plays into that. A lot of people wonder why we're seeing so much increase in MRI accidents. This is one of the reasons, and it's a very important reason. Those powerful magnets require careful protocols to avoid accidents. And if inexperienced staff miss subtle scan anomalies, doctors may miss things like tumors or tears, again, endangering patients. Finally, stretched, thin staff is left working excessive hours, experience more burnout and occupational injury. So if you're already short on technologists and then the ones you have get hurt, now you're even more short. This is a problem. Techs are already prone to back problems, endure harm, lugging away heavy equipment, and maneuvering obese patients for 10-hour shifts. Stress radiologists face higher rates of diagnostic errors, reading overly packed caseloads. This just further worsens the shortage that we face in MRI, cascading the impact across healthcare organizations. But the good news is healthcare leaders are now taking steps to alleviate these interrelated issues. Let's talk about the solutions. As an MRI tech, we talk about burnout and not having enough energy. Let me tell you about Magic Mind, our sponsor today. Me personally, I've been an MRI tech for 21 years and working every shift known to man. I have struggled with my energy levels staying steady throughout the day. At midday, I wanted to take a nap, and it just wasn't cutting it taking a nap. But if you're a coffee drinker, you can understand what I'm saying. Thankfully, I found this little shot to help me get my energy back and be fully focused. I take it because it's so easy to use, it tastes great, and it helped me a lot. But don't let the green color fool you. The taste is great. Even my husband, the other rad tech, approves, and he doesn't drink anything green. I've noticed that my mental sharpness is faster and constant all day. I am way more creative, and my mood is so upbeat, even in these winter months and early dark days. So, what's in this little green drink that I'm telling you about that tastes so good? Well, one, matcha, two, ashwagandha, three, lion's mane mushrooms, and four, cordyceps mushrooms. The 5 and 6 ingredient help with memory, and it's good for stress. We all could use that, especially after listening to this episode of MRI shortages. I tell you, it's enough to stress anybody out. So you make sure you grab your Magic Minds today. I'm going to tell you, I saw a difference after drinking just 2 bottles. And my husband drank it. He saw a big difference in his cognitive focus throughout the day, working long hours in surgery. And a manager in a radiology department, she and her husband now are raving fans. I recommend you do not miss the January deal. Look in the description, click on the link to easily access it, and you can get up to 75% off. Yes. But I'm going to give you 2 other ways. I recommend you get this January deal. Click it in the description to get you 75% off of a 3-month subscription. If you want to get 56% off of a one-time subscription, you can. All you have to do is use this code RADTEX20 and say you just want to try it out. You're not ready for a subscription. That's okay. You can still get 20% off by using this code RADTEX. Make your way on over to magicmind.com. Use my code RADTEX20. Get either discount you want, but hurry up. The month of January is almost over. And if you miss it in January, be sure to get your 20% off using my code. In some instances, we find that healthcare organizations are scrambling to implement solutions. A key priority is making the job more appealing through improved compensation, benefits, and advancement opportunities. I did a poll on one of my Instagram stories, and that was it. Many people didn't want more money. They wanted more advancement. They had been in jobs for a long time and hadn't seen the advancement opportunities, so they were burned out. These are ways of making sure as a hospital, you're not scrambling. Offer things, money, benefits, and benefits can be a multiple options. Advancement opportunities. Everyone isn't motivated by money. Many want to advance either educational wise, leadership wise, some type of advancement opportunity. This means offering competitive salaries, bonuses for overtime, generous paid time off, retirement contributions, and other perks aimed to attract and retain. That is it. You can attract, but you can't keep. That is creating a shortage for particular healthcare organizations. And many hospitals are creating dedicated MRI tech career ladders, which built in experience-based pay bumps. Others offer tuition reimbursement for technologists pursuing bachelor's or advanced imaging credentials to reward skill growth. That is huge. Many people want to go back to school. If an employer paid for it, you know how many people would say, sign me up. Even if they weren't getting the pay, they were getting something else in return. Streamlining credential paperwork and fees also helps retain traveling techs long term. Oh my goodness, when I was traveling, just the money you spend on your credentials, getting all that stuff done, if I was offered to be reimbursed for that, that would move that job up more on my scale over another job. These kinds of incentives and investments in personnel aim to curtail turnover, which has plagued MRI departments all over. Another major push is expanding MRI training programs and slots to graduate more qualified technologists yearly. We're seeing schools pop up all over for people that are already in the field and for those that maybe already have a bachelor's or an associate's degree. There are some schools where you can go right in and make MRI your primary pathway. I talk about that on one of my videos, short form videos. What is a primary? What is a secondary pathway into the medical imaging, specifically MRI? That is really important. Some hospitals directly sponsor students training in exchange for multi-year work commitment post-graduation to fill their own vacancies. That is really smart. If you have people already in your organization and you say, I'm going to pay for you to go to school for MRI, but you have to sign on to work for me to pay it back. It's no different from getting your education grants or monies from a state organization or the state that you live in and they pay for your education. In return, either you pay them back the money that they paid for your education or you work in their state for X amount of period of time to pay that loan off. There's no difference. Like, do whatever makes sense for you, but these options should be out there to help with the shortage for MRI techs. There's another thing that many facilities are really jumping on board to: a flexible schedule. This improves work-life balance for parents, older staff, and just your staff in general. Even single people do not want to be at work day in and day out, working odd shifts every day of the week. Flexible scheduling is one of the key things. I worked at a facility to where they only offered 312s. They did not do 410s. They didn't do 5/8s. They only did 312s. They never had a problem with staff. They still never have a problem with staff. They paid incentives. Like, it was like $8 hour extra on top of what you made already if you worked the weekend shift. I hear there are places now that are giving incentives of $20 to $40 on top of what you're already making as an incentive to work those hours that no one wants to work, which is weekends mainly, evenings. 20, 40 extra dollars more an hour. I would work. I would not say no. I mean, I'm going to tell you, if those things are out there when I was in the field, I would definitely take them. That is a great deal. Finally, some facilities are investing in AI tools to alleviate pressures. Automated patient screening forms reduce clerical tasks. Machine learning can suggest scan protocols parameters to limit repeats from errors. Voice recognition for image labeling removes typing need. While technology cannot replace MRI technologists, it does handle different aspects that allow the technologists to focus their expertise on operating the scanners and caring for the patients. And I talked a little bit about remote scanning. There are some facilities, because they don't have someone that can do cardiac exams or technologists, period, and they have the actual amount of people that are coming in, they cannot keep it staffed. So they have centers where people can actually work, right? Remote centers, and people scan different scanners, maybe 2, maybe 3 scanners at a time. And there's an aide at the facility actually positioning the patient and screening the patient. There's some opinions up in the air as to whether this is safe or not, but it is being done, and it has been being done for a very long time. So the reality is, solving the multifaceted MRI staffing crisis requires commitment across healthcare systems, but it must be prioritized now before the shortage. A combination of boosting pay, expanding training slots, incentivizing new talent, and talent that has already been loyal to your facility is so important, not just your new talent. All of your workers and staff should be incentivized. I think facilities really don't do themselves a justice and do an injustice by paying new staff more than you're paying staff that has been there all of this time. Offering cross training to new people coming in versus to people that are already there, or hiring new graduates from MRI programs when you already have staff there to ask, would you like to be cross trained? Would you like us to send you to an MRI school? And in exchange, they are willing to sign XYZ amount of years to work for you to pay it back. Those are all ways to retain instead of looking outside of the organization. I know a really big organization in the US that has done that. From within, they offer those employees that have been there for a long time to cross train in MRI. These employees have said yes, and they were so excited because they didn't want to leave the organization, but they were getting burned out and they wanted more money. They wanted to learn. This is something that can help the shortage when it comes to MRI. And these are practical things. I would love to know from you all, what are some practical things that maybe your facility has done or that you would suggest that they do as a technologist or as a student? In conclusion, as we've explored, the shortage of MRI technologists is already impacting patients and hospitals across the country. We all know that. But without meaningful intervention, the situation is poised to get much more dire. With MRI use and demand increasing while retirement and attrition thin the ranks of qualified technologists, projections estimate the shortage ballooning to over 20% of needed staff in coming years. This makes tackling the shortage an urgent priority to healthcare industry leaders. Simply put, without staff to run MRI scanners, life-saving diagnoses get missed or delayed for millions of patients. Collaborative efforts can stem the tide and even reverse shortages over time. The first prong is training, expanding program capacity and funding to graduate more MRI techs annually, qualified MRI techs annually. Second, recruitment, making these critical yet demanding jobs more appealing through improvement of compensation, advancement pathways, and work conditions. Third, retention, creating environments where exceptional MRI personnel want to practice long-term through schedule flexibility, career development, and technology advancement. If hospitals, policymakers, and training programs unite around these pillars of expanding supply, recruitment, and retention, we can secure the MRI workforce needed to meet rising demand. But perhaps most importantly, supporting MRI technologists means they can provide the best care for patients. Bolstering this behind the scenes workforce translates directly into superior outcomes, faster diagnosis, more lives saved, and improved quality of life for countless of people relying on MRI scanning. In a healthcare landscape where advanced technology often rightfully takes center stage, we cannot overlook the incredible value of skilled, compassionate, and conscientious specialists operating that technology. MRI, magnetic resonance machine. The MRI technologists make state-of-the-art diagnosis working seamlessly. People think what we do is so easy. It's not. There's a lot of science that goes into it. Each patient is totally different. Expertise and dedication helps detection, monitoring, and treatment of diseases for patients fighting cancer, coping with dementia, recovering from trauma, battling infection, and managing chronic conditions. No question, investing in MRI technologies pays dividends in better care. This time is now for fuller recognition and support to address MRI staffing shortages. With vision, cooperation, and purpose, we can match the growth of this incredible diagnostic tool. With the world-class workforce cooperating it. Here's to the future of life-saving MRI technology made possible by talented, caring, and valued MRI technologists. Thank you for listening to this podcast, and I would love to know, what do you guys think as far as the MRI shortage? Is it good for technologists? Is it bad for patients? And what does it mean for the future of radiology and medical imaging?
And that's a wrap for this episode of A Couple of Rad Techs podcast. We hope you enjoyed our discussion of the fascinating world of radiology and learned something new about the role we play in the healthcare industry. If you have any questions or topics that you'd love for us to cover, feel free to reach out and let us know what they are. And you guys, please, if you enjoyed this podcast or any of the other episodes, we want to hear what you thought. Leave us a review. Mama's got to pay her bills. It helps. And until next time, stay tuned for more insightful and informative episodes of A Couple of Rad Techs podcast.